everybody. I am Dr. Rachel Rubin. I am a urologist with fellowship training in sexual medicine, and I have a practice in the Washington, D.C. area. And I am so thrilled because my co-fellow, the brilliant and famous Dr. Ashley Winter, who sees patients in our practice from LA, is joining us today to talk about sex as a vital sign.
Yes. So to have the best sexual function, you need so many different systems to work, right? You need your hormones to be in the right place. You need the blood vessels to be dilating when you want them to. You need the nerves to be connecting to your peripheral organs, your genitalia, to make them responsive. And the way they say the eyes are the window into your soul, well, your genitals are the window into your cardiovascular system and your peripheral nervous system and your hormonal system, right? They're so dynamic, and it's something that the patient can understand reflects their health. And we just need healthcare providers to hammer home how those two things connect.
So if you're a primary care doctor and you're seeing a patient and maybe you want to educate them on diabetes or high blood pressure, how can you sell it with sex? How can you use sex as a way to really get into these really important medical conditions?
I hate using it as a fear tactic, but I also think you kind of have to, very honestly. So I have seen time and time again men with severe, profound erectile dysfunction at a young age have diabetes with blood sugar levels that have been chronically not under control because it impairs the peripheral nerves. You get that peripheral neuropathy, same way that your diabetes is affecting your fingers and your toes. It's affecting the penis, and probably affecting the penis first, and can also lead to many other conditions such as low testosterone, for example. So that can affect their penis. So I'm just being very brutally honest to say, your diabetes control is so critical to having you have a wonderful sex span, the duration of your life where you're able to be sexually active and have great sex and do it in the way that you want. When we think about high cholesterol, high blood pressure, you name it, lifestyle factors, exercise, right? All these affect your ability to become either erect if you have a penis, aroused if you have a vulva, and even more so to have an orgasm. These chronic conditions can make it so you can't orgasm, really.
And so I've never been asked about any of these issues with any of my doctors. We have to be bringing this up with patients because they're not going to bring it up to us. And so I always say in that review of systems, we really should be not just saying, do you have any sexual problems, which nobody ever does, and we got to move past the men, women, or both, right? We literally should be asking like, hey, any issues with your libido? Do you want to talk about it? Any issues with your erection or your arousal? Any issues with your orgasm? Or do you have any sexual pain? And I think when you can kind of talk about those things, you can actually really look at them from a whole physiologic perspective of how does their sciatica affect their sexual pain? How does their antidepressant affect their delayed orgasm, right? How does their low testosterone, affect their energy levels and their libido and their desire? And there is so much shame and guilt that we see in sexual health where our patients feel broken. When you can make the anatomy and physiology make sense to them and explain you're not broken, you need this medicine for your crippling anxiety, and that's why your orgasm is delayed. And so can we augment it or add or subtract or help you with this? It is that education where you actually see the patient stay on their medications or understand what the plan might be.
In looking at people in a primary care setting or looking at the overall health, we strive for medication compliance, and a huge part of medication non-compliance are sexual side effects, whether it's antidepressants, whether it's beta blockers. Now we're entering this new world of GLP-1s, right? Where we're seeing
birth control. I would also add breast cancer medication. So many patients go off their anastrozole and their tamoxifen because of the sexual side effects.
That is where we get to the crux of this discussion about it being a vital sign, about it being something that you want to check routinely and just become comfortable with, right? Because then you are unlocking this ability to treat your patient like a whole person, give them better outcomes, improve their compliance. and also have a really powerful tool for education.
We have a growing toolbox for all genders when it comes to sexual health. We have FDA-approved medications for low libido in women. We use testosterone in men, evidence-based, to safely help improve their libidos as well. We use medications to help with the genital and urinary symptoms of menopause. Orgasm is a challenging one, but we can have devices be used to really help with those reflexes. And sexual pain, understanding where they have pain and working with people who specialize in this can be extremely helpful to helping your patients with pain. And so having done this, Dr. Winter, in multiple sort of different practices, what would you tell the primary care doctor who doesn't really want to talk about libido or who minimizes sexual complaints because they don't really know how to navigate them?
Yeah, I do not envy the challenge of being a primary care provider in this healthcare world we are living in. I think it is the hardest job. The ultimate takeaway is to just normalize the conversation and be able to validate that this is happening, have a few basic tools, and then have referrals, right? So it's not that you have to have all the time in the world or you have to treat every condition, but you have to open the conversation, be comfortable about it, and then get patients hooked up with the right resources.
But every doctor of every kind can connect with patients and really try to understand what is it that they care about? What are their goals? What do they want for their families, for their relationships, for their quality of life? And how can we work collaboratively as a team to just help them with those things, right? And so sex is a huge piece of people's lives. And if we don't ask about it, if we don't look into it, and if we don't admit that our physiology, our medications, our surgeries can affect all of those things, how can we improve people's quality of life? And I think we can do so much as a team to help people with sex being a true vital sign. And thank you for joining me.
Yeah, thank you for having me.